When there's a shooting in our area, you'll often hear us say something like, the victim was taken via ambulance to Strong Memorial Hospital. And when that happens, the team waiting for them is from the Kessler Trauma Center, often. Dr. Mark Gestring runs that center, and the FBI recently recognized him and his center's efforts to prevent gun violence. Gestring and I sat down this week to talk about those programs and what the recent spike in gun violence has looked like from his perspective in the ER.
So you see the impact of gun violence up close?
Every day. Every day.
What's that like?
Well, it's what we do, so it's a big part of what we do. I've been in this community for 20 years, and I think it's worse now than I think it's ever been as far as what I see. And for every, people easily look at mortality, people who died, but you don't see the toll of every, you have 2 and 3 people shot every night, that's a lot of what I consider to be pretty senseless injuries, because these things didn't have to happen.
Those folks who live, a lot of them are probably going to live with that pain or the repercussions of that for the rest of their life, I would think.
So if you're lucky enough to be shot through something that doesn't matter, then you're healed, and a couple of months later you're back to normal. But many times, like you said, you can have spinal cord injury, you end up needing a colostomy, end up needing multiple surgeries.
This impacted you as well. It prompted you to try and work on the larger problem. How did you go about doing that?
The thing that I've been involved in for the longest is something called the Rochester Youth Violence Partnership. There were 2 specific kids, if you will, young people, that kind of triggered our program. And the first was he must have been 13 or 14-year-old kid who was shot in the butt. And he came into the trauma center, shot in the butt, and he was absolutely furious, right? Not that he was shot, but the fact that the bulletproof vest that he had didn't cover the area where he was shot. So we started to think, why is this kid getting up and putting on a bulletproof vest in the morning? There's something wrong with that. And what we did was we put this group together, kind of led by the hospital, but still with multiple partners, to say, look at each individual episode, if you will, and say, all right, well, why is this happening? This is happening because the kid's involved in a retaliation situation, so maybe we can offer the opportunity to move this kid somewhere else. And working with the school district and with police department and with a number of social agencies around town, we were able to really do that.
And you end up talking with a lot of the patients, I'm guessing, those who are conscious. And what kind of things do you hear from them?
In retrospect, people look back and say, this really didn't need to happen.
This didn't really need to happen. All right, there are a couple of other programs that Kessler is involved with. He's promoting Stop the Bleed being one of them. You can learn more about those programs in the full interview with Gestring. That's up right now over at rochesterfirst.com in the Adam Interviews section.